What are 30-day no-sugar challenges? All you need to know. Reducing your intake of added sugar over time can benefit your overall health, including helping you maintain a moderate weight and healthy blood sugar levels. There's no doubt that consuming too much added sugar harms your overall health. Unfortunately, most Americans consume far too much added sugar in the form of soda, candy, sweetened baked goods, sugary breakfast cereals, and more. Cutting back on added sugar is important, as excessive consumption is linked to an increased risk of certain health conditions, including fatty liver, type 2 diabetes, and heart disease. To reduce their added sugar intake, some people take part in no-sugar challenges. These challenges typically involve cutting out all forms of added sugar for a set amount of time, often 30 days. How do 30-day no-sugar challenges work? Many types of 30-day no-sugar challenges exist, but most have similar guidelines. The main goal is to cut out all sources of added sugar for 30 days. Instead, you focus on consuming nutrient-dense, whole foods that don't contain added sugars. Natural sugars, which are found in foods like vegetables, fruits, and dairy products, are okay to eat. The focus is on cutting out added sugars and foods high in added sugars, including sugary breakfast cereals, ice cream, cookies, cakes, candy, soda, and sweetened coffee drinks. Again, there are many variations of the 30-day no-sugar challenge, so the rules and recommendations may differ by program. Do 30-day no-sugar challenges have benefits? Blood sugar. Frequently eating foods and drinking beverages high in added sugar harms blood sugar management and may increase your risk of type 2 diabetes. Sweetened foods and drinks like baked goods, soda, candy, and energy drinks contain rapidly absorbable sugars like high fructose corn syrup. Diets high in these types of sugar have been linked to high blood sugar levels and insulin resistance. Insulin resistance is a condition in which your cells become less sensitive to insulin, a hormone that regulates your blood sugar levels. This may lead to elevated blood sugar and insulin levels, which can eventually cause cell damage and increase your risk of several diseases. Cutting back on added sugar is a good way to reduce blood sugar and insulin levels, even if you only do so for a short time period. However, if you cut out added sugar for 30 days only to return to a high-sugar diet after the challenge is over, these benefits will be quickly lost. Body weight foods and beverages high in added sugar tend to be rich in calories yet low in filling nutrients like protein and fiber. For this reason, a diet high in sugary foods has been linked to weight gain. Cutting out sources of added sugar may help you lose weight, especially when paired with a nutrient-dense diet that's high in protein and fiber. Oral health. It's known that sugary foods and beverages aren't good for dental health. In fact, added sugar intake is strongly linked to an increased risk of cavities and gum diseases in both children and adults. This is because bacteria in the mouth break down sugar and produce acid that may damage your teeth. Therefore, cutting out added sugar can protect your teeth. That said, only cutting out sugar for 30 days is unlikely to have a lasting effect on dental health, liver health. High sugar diets, especially high fructose diets, can increase the risk of developing non-alcoholic fatty liver disease, NAFLD, a condition characterized by fat buildup in the liver. Based on these findings, it's likely that cutting out sugar, especially foods and beverages sweetened with high fructose corn syrup, is likely to reduce liver fat and improve liver health. Heart health. Sugar-rich diets are linked to heart disease risk factors, including high blood pressure, triglyceride, and LDL, bad cholesterol levels. Diets that limit added sugar, such as the paleo diet and whole foods plant-based diets, have been shown to significantly reduce heart disease risk factors like high triglyceride and LDL cholesterol levels. Foods to eat and foods to avoid. Foods to avoid. While following a 30-day no-sugar challenge, people are encouraged to restrict foods and beverages high in added sugars, including sweeteners, table sugar, honey, maple syrup, corn syrup, agave, coconut sugar, sweetened beverages, soda, sweetened smoothies and juices, sweetened coffee drinks, sports drinks, condiments with added sugar, ketchup, BBQ sauce, honey mustard, coffee creamer, sweetened dairy products, flavored yogurt, ice cream, chocolate milk, sugary baked goods, cookies, cakes, donuts, bread with added sugar, sugary breakfast foods, sugar-sweetened cereals, bars, granola, flavored oatmeal candy, chocolate, gummy candies, caramels, sugary alcoholic beverages, mixed drinks, sweetened liquor, sweetened canned alcoholic drinks. Foods to eat during 30-day no-sugar challenges. Participants are encouraged to fill up on whole, nutrient-dense foods, including vegetables, broccoli, cauliflower, spinach, carrots, asparagus, zucchini, sweet potatoes, etc. Fruits, apples, oranges, berries, grapes, cherries, grapefruit, etc. Proteins, chicken, fish, beef, tofu, eggs, etc. Healthy fat sources, egg yolks, avocados, nuts, seeds, olive oil, unsweetened yogurt, etc. Complex carb sources, beans, quinoa, sweet potatoes, butternut squash, brown rice, etc. Unsweetened beverages, water, sparkling water, unsweetened coffee, and tea. If you decide to partake in a 30-day no-sugar challenge, use it as a time to discover which foods or beverages are contributing most to your total added sugar intake. This can help you cut back on those sources when the 30-day challenge is over. After the challenge, try not to focus on giving up all sources of added sugar for good, as this is unrealistic for most people. Instead, attempt to transition to a diet low in added sugars and high in healthy foods that you can follow long term. Keep in mind that you can create your own challenge that focuses on reducing not completely restricting added sugar. This may be a better choice for people who currently consume a high amount of added sugar. Lastly, it's important to understand that your focus should always be on your long-term health. Instead of focusing on completely cutting out certain foods or beverages, try adopting a way of eating that nourishes your body while allowing you to enjoy your favorite foods occasionally.